and welcome to our viewers from around the world. I'm Kristen Schwartz, licensed midwife and MC here at Gold Learning. And here at Gold, we are preparing for a brand new lecture pack that we have in the works, and it's titled Breastfeeding Medicine, Advancing Your Level of Care lecture pack. And with me here today is one of our speakers. I'm so excited to have you back here, Dr. Mariana Colmenares Castaño.
Hi, thank you, Kristen. I'm very happy to be here also. Thank you.
It's wonderful to have you back. You're back by popular demand. And thank you so much that you have time for us here at Gold and sitting down with me here a little bit. So for our listeners who are not yet familiar with you and your work, tell us a little bit, first of all, where in the world are you? And then tell us a little bit about your work and your background.
Well, I'm in Mexico City. I was born here and I have been living here for all my life. I'm a pediatrician and I did pediatrics in a big hospital here at the National Institute of Pediatrics. And when I finished my career, it was like the pandemic of influenza and I was pregnant. So the things weren't as good as it should. And I started getting into the topic of breastfeeding because of my own pregnancy and I couldn't continue in the hospital. So it was like different kinds of things around like that I couldn't control. So I started getting into the breastfeeding medicine and I became an IBCLC in 2011. And since then, I have been working in my own clinic with breastfeeding pairs like mothers and babies and parents. And also I teach. I have a 120-hour teaching of breastfeeding and now an online teaching in Spanish of breastfeeding 200-hour course online. So that's what I mostly do. I'm a mother. I have two children, one of 11 years old and the other one of 6 years old almost, and breastfed for around 4 years in total. And well, that's me.
That's wonderful. So breastfed for 4 years in total. That's fantastic. And I'm sure last time we talked, we were kind of going into the heights of COVID-19. And here we are again. It looks like we're going in for another spike of cases. How does it look in your area, Mariana?
Well, actually here, the pandemic, it has been like very, very long. In the beginning, we did lockdown a little bit, mostly we did. But now things weren't as bad. We use like a red, yellow, and green light, like to know where we are. And now we are on orange. Well, it's like orange. And they suggest you not to go out. So it's a semi-lockdown. But economically, it's a country that we cannot bear, like to be locked down at all completely.
Right.
So cases are going up, so it isn't as easy.
And in Mexico City, it's a big city. I can imagine it's people are living very close together there as well. Are you able to see clients right now in person, or has that been difficult?
No, yes, I have been doing clients in person. I started doing a lot of online. And I really like it. It was a big thing that I learned with a pandemic. Actually, I never did it before, maybe because of my background of medicine. It's difficult for me like to not to touch and to see the babies. So it's difficult for me, but I started doing it and it's something that is going to stay later on. It's going to stay. Because online breastfeeding, it's a very, very good thing to do. And I have been able to see people from around even the world, from France and Bolivia and many places. So it has been a very interesting thing to do. So I think that will stay. And now I go to the clinic and I see patients.
So you're in person and still the online component. And I can imagine, as you mentioned, you can see clients that are from around the world, or maybe even in your country, but in more rural areas that might not have access to a professional like you on a regular basis in person, right? So that is definitely
that's great. Very, very great.
You mentioned you're a pediatrician before you became a breastfeeding expert. So let me ask you this. We think of pediatricians, the experts on the baby. How much education did you have in breastfeeding before you became that expert? And did you have to go, do all that education, or were you able to jump right in and be ready as a breastfeeding expert?
No, well, actually, for in the career, they teach you a very small amount of breastfeeding medicine, like
Hmm.
maybe 2 hour. Like it's amazing. The yeah, it's
Yeah.
we don't have anything about breastfeeding. We don't even have it like as a topic from the career. No, like it's not a part of a career. So I really got into the breastfeeding medicine. Always liked it. Actually, it's something that you maybe you have to go with what you like,
Yeah.
and I love like more natural things, and I'm not of a lot of technocratic medicine law, so I'm
Hmm.
much more like with the mother and the family and things. So I think I almost always support mothers with breastfeeding, but I didn't know a lot about that. And actually it was when I was pregnant actually that I got into. So I started to take courses online, and I practiced in the hospital where I worked at that moment. So it was like the what I did, like I started looking for breastfeeding medicine. Actually, when you're a pediatrician, you are always in touch with mothers and babies, but you never get
Right.
to know about breastfeeding until you get there. No, you like it's like something like somebody else will treat, or somebody else will talk about that, or somebody else
Yeah.
will support, and then suddenly you are the one that has to support the mother with all of that. No, so I really enjoy it, and I that's how I got into the to this. And well, now years before, so all these years I have been like learning, and it's a topic that you never stop learning actually. Every
Yeah.
day you can read something new about this, and it's amazing.
It is absolutely amazing and fascinating. And what you said is absolutely correct. There's new research coming out every day. And finally, we have good, solid research, and what we find out about not only the nutritional value of breast milk, but also the other components that are so important, so for the mental well being, both of mother and baby, it's just phenomenal what we learn there as well. So yeah, but it is kind of surprising if you think of a pediatrician. You are, trained to do everything. Take care of baby and food. Breast milk is part of that as well. So it is interesting that pediatricians and do not learn so much about breastfeeding in their training.
Yeah, no, it's very bad, and I think that what actually happens a lot is that the formulas, the infant formula companies are very inside the big hospitals where they
Hmm.
teach. So they are in charge of the teaching for many of the doctors in training. So I think that that's a very bad thing that happens. Well, in Mexico happens a lot. So I think we
Yeah.
have to really get on to really supporting teaching without having all this conflict of interest.
Absolutely. Let's talk a little bit about your topic here, which I find very interesting. You're going to talk about in the presentation here antenatal breast milk expression, setting families up for success. So, antenatal breast milk expression, that is a very interesting topic because for many of our clients, I'm a midwife, I sometimes hear, oh, I don't have milk. How can I express something? I thought the milk comes after the baby is born, right? So tell us a little bit about what you're going to talk about and how can we, educate our clients accordingly.
Yeah. Well, a great thing about this topic is that the moment you get to see the mother that you're going to teach her about antenatal breastfeeding expression is during pregnancy. And
Yeah.
that's the best moment to talk about breastfeeding. So I think it's not just about expressing, but the support that you can give the mother about the milk and the expression. Even if you don't get any of colostrum or anything before the baby is born, you already teaching her many skills that she
Yeah.
can use maybe later. So I think that's the amazing thing about this, that we can really have the contact with these families before the baby is born, so they will get to that moment more knowledgeable about what they
Hmm.
have to do. So for
Hmm.
that thing, I think it's a very good thing to know.
Yeah.
And I think this is a great topic also because there's not much, a lot of information outside. It's a nice, even though every mother are aware of their own breasts and how they grew and during
Yeah.
pregnancy and how they change, but and if they have a little bit of secretion, but we are not aware of what we can do actually with that. So I think that it's a very interesting because you can help mothers with different kind of diseases, maybe diabetic mothers, for example. So it's a good skill to know,
Hmm.
and how to support families before, so they can get a better breastfeeding journey later on.
Interesting. Interesting. I can't wait for that topic. And I'm very excited learning more about this. Before I let you go, Mariana, can you give us a little nugget of wisdom with regards to your topic, or anything you feel like you want our audience to know today?
It's a difficult question. I don't want to tell you many things about the topic, so you can look at it a little bit more interested. But maybe a good thing. It can be useful for mothers with different things that can affect like breast milk production. So antenatal breastfeeding expression can be useful for the mothers that have something.
Okay.
So this makes us be aware of a good history that we can take from the mother before the baby is born. So that also makes us more like near the mother to help and support her for what could happen later on when the baby is born. So it's good for them, and it's not nothing that can affect neither the mother nor the baby.
Perfect. Wonderful. Thank you so much. I'm so excited about the presentation coming up here at the lecture pack that we have available on November 9th. And your presentation, Antenatal Breast Milk Expression, Setting Up Families Up for Success, is part of that lecture pack. And thank you so much, Dr. Mariana Colmenares, for spending time here with us. And we're looking forward to the presentation.
Thank you, Kristen. It was a pleasure for me. Thank you.
And for our audience here, if you would like to find out more about this package, you can visit goldobstetrics.com and also goldlearning.com and learn about also the other presentations in the lecture pack as well. Thank you, everyone, for listening and watching today. Have a wonderful day. Bye-bye, everyone.